Bismillahirrahmanirrahim. Today we will have case quiz number 9. Case data: 78 years old male. The main complaint: hip pain for few months. Pain relieved somewhat with non-steroidal anti-inflammatory drugs. Investigations: ESR within normal, CRP negative, urea within normal, creatinine normal, bilirubin ALT within normal, serum calcium level normal, alkaline phosphatase is very high, 973, and the normal is up to 300 only. X-ray show loss of trabeculae, abnormally thickened bone, and sclerosis as you see in this X-ray. So, what is the diagnosis? The answer is yes, Paget's disease. The answer is Paget's disease. Paget's disease. This elderly man has a very abnormal pelvic X-ray with evidence of loss of trabeculae, abnormally thickened bone, and sclerosis. In combination with his history of bone pain and elevated alkaline phosphatase, the most likely diagnosis is Paget's disease. Paget disease is a condition of disordered bone remodeling with increased osteoclast and osteoblast activity. Indeed, it is the accelerated osteoblast activity that gives rise to elevated alkaline phosphatase. Although most commonly asymptomatic, the bone architecture in Paget's is mosaic-like and mechanically weaker than normal bone. As a result, bone deformity, e.g., tibial bowing or spontaneous fractures, may result. Paget's bone is also hypervascular and may feel warm to palpation. The majority of Paget's, around 80%, is polystatic, affecting several bones simultaneously. This is the meaning of polystotic. When the disease is isolated to a single site, the tibia and iliac bone are the most commonly affected areas. Complications of Paget disease include skeletal, bone pain, deformity, bowing, skull enlargement, and fractures. Neurological, due to compression syndromes, may lead to deafness, spinal or cranial nerve entrapment, and spinal stenosis. Cardiovascular, hyperthermia and warmth of affected area, high output congestive cardiac failure, carotid steal syndrome to Pagetic skull, malignant changes, osteogenic sarcoma, metabolic hypercalcemia in the presence of fracture or immobility. The diagnosis of Paget's disease is the combination of radiological and biochemical abnormalities. Plain X-ray reveals a mixture of sclerotic and lytic lesions and significant trabecular thickening. Osteoporosis circumscripta refers to extensive lytic disease affecting the skull. Full body scintigraphy may be used to determine the extent of disease, as affected areas show marked increased uptake. In practical terms, the main indication to treat Paget's disease is pain. In this case, although bone deformity or compression syndromes or risk of fracture would also prompt therapy. The treatment of choice is bisphosphonate to diminish osteoclast activity, interrupting the vicious cycle of chronic bone remodeling. Intravenous zoledronic acid or zoledronate, Aclasta, is highly effective in this regard, and serum alkaline phosphatase and time 1 procollagen B1 and B levels are sensitive markers of bone formation and are suppressed during successful treatment. Patients should be regularly reviewed for change in symptoms or elevation of these biochemical markers. Either would be an indication for retreatment. And finally, thank you very much for your attendance, and we will meet you in the next future with case quiz number 10. Wassalamu alaikum wa rahmatullahi wa barakatuh.